Hi, I'm Dr. Keenan. Have you ever been thinking about your health and that it all seems like a little bit of a puzzle and you wonder, how can I piece all the puzzle together? Well, as a physician, a functional medicine physician, a lifestyle medicine physician, I find this every day in my practice. I'm trying to get to the roots and this whole picture of health as to what's going on. You know, I think a lot of things that happen in healthcare right now is we really rush through things. You know, we're trying to get a quick answer, we're trying to get a quick solution, but it doesn't simply end that way until we start to bring in all of the pieces of the puzzle together. So I want to tell you about a patient that I saw this week. So this was a 45-year-old female that came in for pain, and she said her pain was out of control. She'd been seeing some other practitioners, and the practitioners had put her on gabapentin. So the pain was in her back, it was really non-specific, and gabapentin is a medicine that's used for chronic pain. So they started her on 100 milligrams 3 times a day, then 200 milligrams 3 times a day, then 300 milligrams 3 times a day. And she came to me and she said, I'm just not feeling any better. And I said, well, what else is going on in your life? Because pain always has a reason. Pain can be acute, right? So if you fall and hurt yourself, yes, that's acute pain. But for something like this that's been going on 4 to 6 weeks or more, we have to get to what else is contributing. So what was contributing? Number one, she's a diabetic and her blood sugars are currently out of control. She said she can't get her sugars down to less than 14. She's on insulin, she's taking diabetic medications, but they're still out of control. So along with this, her anxiety is out of control. So again, we're starting to see this picture. We know that blood sugar and anxiety go hand in hand. And I also know that when you have high sugar and high anxiety, you're releasing a lot more cortisol. Cortisol is a stress-based hormone. And what does it do in the body? It promotes a lot of inflammatory markers in the body that can give more and more pain. So she also, of course, she wasn't sleeping. She did a night shift job. So it is hard for people when they're doing shifts back and forth. But this really wasn't helping the situation at all. And so she was really to the point, she said, I think I'm burnt out. And part of her reason for visit was to have a work note because she needed to be off on some stress leave for a little while. So this was a 45-year-old woman. So what's going to be the next question I'm going to ask? What are your menstrual cycles like? And she's like, oh, they've been spacing out. I went 8 months. I didn't have a period. And then I had one. And then there's 2 more months. And then I haven't had a period for 2 months. So then I asked her about hot flashes. Yes, she's getting hot flashes every day. She's sweating so much. So then I'm starting to think, you know, could this be partly perimenopause that's contributing to this big situation and maybe making everything a little bit worse? She was also having low libido, low sex drive, having vaginal dryness, and just having brain fog. So again, there's no one right piece to this. There's no simple one answer, but we really have to consider it from all aspects. And we do have to incorporate hormonal health as to why this woman can be having pain out of control that's not getting any better. So then I started to explain things to her and I got her to start thinking about it. I said, well, do you think it could be your hormones? And she's like, yes. She's like, my mother, she went into menopause just when she was like in her late 30s. And, you know, I think she has had her aunt had an early menopause as well. And she said, I've been thinking about that and I've been wondering, but she said, nobody's ever asked me before. So again, this is the puzzle. You know, we have to think about health, mind, body, spirit, sleep, food, hormones, lifestyle. All of those things are super, super important. So then as I began to talk a little bit more to her, we started talking about number one was sleep. You know, she's 45. She says, I haven't been sleeping well in years and years. Now, again, the shift work interferes with it, but also poor sleep can be one of the earliest signs of perimenopause. And I really think this is what was going on partly in this woman. And then we started thinking about her blood sugar. And she said, you know, it's only the past couple of years that I've been diagnosed with diabetes and my sugars are more and more out of control. I try to control what I eat, but still my sugars are rising. So we also know for women as they go through perimenopause that as estrogen goes down, blood insulin levels can begin to rise. Many women do develop prediabetes and insulin resistance as a result of the shift in their hormones. And she really felt that this was probably a contributing factor because she started to tell me a little bit more about the hot flashes and how they'd been going on for a while. And again, this poor sleep and even her pain. She said the pain had been there before, but it was just getting that much worse over the past couple of months. So what about pain and perimenopause? What do we know? So Dr. Vonda Wright, who is an orthopedic surgeon in America, she and colleagues, they did a research paper just last year on what's called now the musculoskeletal syndrome of menopause. Because many women, as estrogen levels begin to decline, they begin to develop more and more joint pains all over their body. And a lot of times, like I believe for this woman, she was kind of being labeled as back pain, maybe even fibromyalgia, but I really feel that it could be the contribution of the hormonal changes. But also, too, we do know her blood sugars were out of control. And we know that as your blood sugar and your A1C rises, more and more inflammation gets in the body. And when I talk to people about blood sugar and pain, often again, this is not a piece of the puzzle they ever put together before. But if you think about our blood and blood sugar, as blood sugar rises, our blood gets kind of sticky, right? So it's this stickiness in the blood that can make us more prone to heart attacks, to stroke. And now we even know diabetics are more prone to Alzheimer's disease because of the sticky blood, if we call it, that gets in their brain. But this also can cause a lot of pain and inflammation in through her joints. So we spoke about this more and more, and she's like, this is making more and more sense, Dr. Keenan, that this may be a contributing factor to what's going on for me right now. And she's like, well, do I need to have my blood levels checked? What do I need to do? And I said, you're 45. You have symptoms of perimenopause. We don't need to do a blood test to know this. We can treat you based on your symptoms. So then I discussed the management for her. So we spoke about estradiol and we spoke about progesterone. So her sleep is terrible. So progesterone, we know for many women, I've seen a few, it can really be a miracle pill when it comes to their sleep. Now, this is not a miracle drug for everyone, but she said, yes, I want to try progesterone to see if it can help my sleep. Then we started talking about estradiol. So what would be the reasons she would use it? Number one, she's getting hot flashes every day. And we know the number one treatment for hot flashes in a 45-year-old woman is going to be estradiol. So she chose to go on a topical patch to use for her hot flashes. And then the hope is that also we're going to get a little bit better control of her blood sugar, because we do know when the studies were done that estrogen-based therapy started within 10 years of menopause. Women will have lower incidence of diabetes and lower incidence of heart disease. And also we know it's going to protect the bones. Now in this situation, we're not talking about her bone density, it's more the pain in her bones. So we went through what this looked like. So she was going to be starting estradiol, progesterone, and then for the vaginal dryness, because that was contributing from her relationship that she was having with her husband, then she started on a vaginal estradiol to help with those symptoms. And as we put this all together, like I saw her eyes light up a little bit because she was thinking, this is not just all in my head. And so many women feel this way. They feel overwhelmed. They feel like, what's wrong with me? Why can't I just control this? Like, why is my anxiety out of control? Why is my sugar out of control? I'm trying to do the right things and the pieces are not just getting put together. But when we added on this hormone discussion, I think she really left feeling that, wow, I think I'm getting a better understanding of what's going on right now and in my life. So I'm out here today and I'm hoping that if any of this resonates with you or can resonate with a friend that you might know, you may want to share this. Because so much I see in healthcare, we still band-aid treatments. We look for pain and a drug. We look for poor sleep and a drug. But we have to get down to that base level to see what might be causing the root of those issues. So as she got ready to leave the office, I did give her a week off of work because she needed some time to rest. And she was going to have a follow-up again with a physician in a couple of weeks to see how she was feeling. And hopefully when she's on her hormonal therapy, that will be one of the steps to the beginning of her feeling better. Also, she's going to be lined up with a therapist to help her to overcome the anxiety. Because that's the other part of this puzzle too, is that a one-time assessment, even by a physician like myself, and I like to think that I'm holistic, but we need a team around us. There's a phrase that says it's teamwork that makes the dream work. And I reinforce this a lot to my patients, that we have to think there's going to be different members of the team that will add to things. So right now in my practice, I have a health coach. I'm the physician, the prescriber, really helping to put the puzzle together. But I refer a lot out to nutritionists. I refer out to acupuncture, to energy work, to physiotherapist, to pelvic floor therapist, whatever this may be, because this is part of the team. So again, if you're working in a team, I'd love to hear about it, how it's going for you, because these are parts of the secret to helping us feel good overall and for helping us to feel good in the long term. So if you want to hear any more about my work and what I do, I'm taking my programs, my monthly program, a little bit further. And so I've been running what's called the Inner Circle now for about 2 years. We meet every Tuesday for health education-based topics. Starting in December, the program's going to be changed to what we call Wise Woman Rising. And what I'm starting to see more and more, it's the wisdom that we start to gain with our age and with menopause and perimenopause and all these changes that come. So I'm going to be transforming the program over every Tuesday night from 7 to 8. You'll be able to meet with me or one of my teachers to give you health-based instruction and education. But the first Tuesday of every month is a live question and answer with me. So this is going to be starting this Tuesday in December. So if you want to know a little bit more about it, please drop me a link below, and I'm also going to have some information for you to share as well. So I hope you all have a wonderful Friday. Share this with someone that might be looking for how they can get the pieces of the puzzle together. And if you want to begin by trying to figure out how you can connect the dots, then please feel free to join me in the Wise Woman Rising Circle starting out on Tuesday. Take care, everybody. Have a wonderful weekend. Bye for now.